The central nervous system is the main control center for the entire nervous system. All sensory information must go through the spinal cord and/or the brain before being interpreted. Several different types of central nervous system drugs are used in clinical settings. However, most drugs used either depress or stimulate the central nervous system. Tranquilizers are the first central nervous system depressant we will cover. Tranquilizers are usually used to calm an animal. Phenothiazine derivatives are tranquilizers that usually produce sedation and reduce anxiety without providing pain control. These are usually used either pre-anesthesia or with anxious animals. Example of phenothiazine is acepromazine. ACE is a common drug of choice for a pre-anesthetic because of the safeness. The second group of tranquilizers are the benzodiazepines, also commonly referred to as Valium or diazepam. Diazepines are commonly used as an injectable or a tablet and can be used as an injectable sedative, but at lower concentrations can be used as an anticonvulsant, muscle relaxer, or appetite stimulator. One main concern is to never store diazepam solution in plastic because of the potential for the ingredients to leach out of the solution and into plastic. Xylazine is an agent commonly used as an anesthetic. It produces a deep sedation, has analgesic properties, and can be used as a muscle relaxer. An important note is that there are two different concentrations: a small animal at the 20 milligram per mil or the large animal, the 100 milligram per mil concentrations. Caution is also needed for several species while using xylazine. It can cause heart block in dogs. Cattle are extremely sensitive. Dissociative agents are the third class. They are characterized by involuntary muscle rigidity, amnesia, and analgesia. Used by themselves, it is recommended to only perform restraint diagnostic procedures and minor surgery, such as putting in staples or stitches. One common agent is ketamine. Usually, ketamine is used with the tranquilizer in order to enhance muscle relaxation and deepen the level of anesthesia. As a precaution, place ophthalmic ointment into cats' eyes after administering ketamine while during anesthesia because their eyes will not close. Hypersensitivity to noise and light may occur during recovery. Opioids are administered for their analgesic and sedative properties and are often used as pre- and post-anesthetic agents. At low enough doses, opioids can be antitussive and antidiarrheal. They also slow down the GI tract and can cause constipation if given too much. There are naturally occurring and synthetically produced opioids. One example of a synthetic opioid is butorphanol, or Torb for short. Barbiturates are one of the oldest classes and are used as sedatives, anticonvulsants, general anesthetics, and as a euthanasia agent. Problems with barbiturates are associated with the high potency of depressing the cardiac and pulmonary systems. They are not reversible after administration, and ultra-short barbiturates can cause tissue necrosis if administered outside of the vein. The three classes of barbiturates are long-acting, short-acting, and ultra-short-acting. Long-acting barbiturates usually are effective for 8 to 12 hours. Phenobarbital is used to help control seizures. Short-acting barbiturates like pentobarbital last 45 minutes to an hour and a half unless used for euthanasia. Although during the infancy of veterinary medicine, pentobarbital was used as a general anesthetic, nowadays it is used as a seizure controller and as a euthanasia agent. Inhaled anesthetics are liquid anesthetics converted into a gas via an anesthesia machine. They are the preferred anesthetic because of the large safety window, controllability, and ease of elimination. Propofol, lovingly referred to as milk of amnesia because of its color, produces a smooth, rapid induction when given slowly IV. It is often used as a replacement for barbiturates and sighthounds because of the lack of fat, and during cesarean section because it does not cross the placental barrier.